Hey folks, we're back. I'm your host, BKP. It is time for Ask the Doc. We always want to thank North Georgia Cancer Research Center, affiliated with Northside Hospital, for this great information, and Dr. William Whaley and Dr. Raymond Tidman with us here. We're at downtown Blue Ridge, Georgia. Come visit us. Yeah, there you go. Get away from the storm.
Yeah.
It's a crisp morning. You said that, didn't you?
Yep. And I also told you that we missed all that terrible rain, so the trees have not fallen over the highways.
Right.
Sun's out. You can play golf up here today. You can go fly fishing. And right now we ought to be wearing a sweater because it's about 60 degrees up here.
You can sit on the back porch, smoke a cheap cigar. Not that my doctors recommend that or anything. That's the Surgeon General.
Speaking of the tie,
we're getting to that. There
with
you
her
go.
Smoking a cigar. Okay, read the tie.
Preventative medicine.
All right, this was given to me by a grateful patient about 20 years ago, and now that I'm cleaning stuff out, I'm wearing this today in honor of our guest Ray over there, who I'd say is in the preventive medicine business, and he keeps saying that this blinking virus that's going around. Did y'all know there's a virus going around?
Really?
Yeah. That this virus that's going around are keeping people out of the doctor's office. Well, I saw a patient on Wednesday who has had a cough and who has been feeling lousy for blinking 6 months, and tried to get an appointment with a doctor and didn't have a television, kind of a camera or anything, and didn't get in to see anybody, and because whatever it was, and ended up in the emergency room 4 or 5 days ago, and has got a malignancy that might have been found 6 months or 8 months ago. And it just put me in mind of what Reg keeps saying, that you got to keep living your life, and you got to keep going in and getting your blood sugar checked and everything else. And I think that the COVID virus information is encouraging. And here people this week, there's been all this conversation about long haulers and people who are sick 3 and 6 months after they get out of the hospital, and I just think today it's our job to try and put some proper data out here and take the political spin out of it. So that's how I want to get started, and I want you to say a little bit about those numbers, and I'm going to try and tell you why that's encouraging.
Well, you know, I like the take the political spin out of it, as you know. I keep up with the political spin, not that I enjoy to do it, just to keep up with what that spin is. And you know, folks, we always tell you, you can go to the Department of Health, Georgia Department of Health website. Now, if you're out there in Tennessee, North Carolina, or anywhere, all of the states have a Department of Health website. Your state has that. And the majority of the ones I go on have an interactive map. So, for example, the Department of Health, as we've said before, I can scroll right over Fannin County, and it tells me September 17th, cases the last 2 weeks, 92. Okay? Cases per 1,000 the last 2 weeks, 350 per 1,000, and so on and so forth, the population. How do we, and I think this is a question, I don't know if we've really dug into it. You have the hospitalizations up, I know you want to talk to it, but when people go on this websites, how do they read the data?
All right, I think, first of all, I think that's really important. Let's go first to the thing that you hear the most is how many cases there are, and the problem is that they make that diagnosis of cases by how many positive tests there are. And every week we say you want to get below 5%. So here's the number for this past week. Excuse me, yesterday. They did 25,000 tests yesterday. 2,300 were positive, and 9.2% were positive, and that's up from the 7% 3 weeks ago. Now, if you look at the hospitalizations, there were 170 yesterday. That's almost half what they were 3 weeks ago. And what I said, this big number of positive tests, in my opinion, and if you just look at the numbers, I'm sure I'm right, is because there were 1,400 of them at the University of Georgia over a week, and 275 in another university in Georgia, and they've come back to school. Well, a month ago, all those kids were all over the state. They were not being tested. So now it's like you've herded what, a couple 100,000 kids into a place where they're going to have to be tested. So you're just picking up people that you were picking up one or two at a time before. That's encouraging, because that number says you're getting all these people tested. Yeah, there's positives out there, but the ones that are getting sick are going down, because these positives are a bunch of college kids. Now, the thing that's been really big in the news this week is this business about the long haulers. And
right, I'm reading that.
Yeah,
That's what
all
you
right.
got.
It's got a bit about the long haulers, and what I'm trying to say is that you don't get to be a long hauler unless you are in the hospital. So first of all, we've just said the hospitalizations are going down, and when you're reading these things in terms of per population, Fannin County right now, as you just read the numbers, where is it? Fannin County has the case positivity in Fannin County was about 570. That's 2,165 per 100,000 population. Well, Fannin County's only got 20,000 population or whatever it is, but that number per 100,000, we used to be way at the bottom. The statewide level is 2,778 per 100,000. So since we don't have any packing plants, we don't have any carpet plants in Fannin County, that number right there is a very reasonable amount of positivity for a rural county that's got a lot of older people, and I'm not the least bit worried about that number. But it was 50 for about 3 or 4 weeks.
We opened the conversation with talking about the need to kind of be positive and get back to normal. And to me, the numbers that we're seeing, that we're talking about this morning, we really have to talk about that there's really 2 sets of numbers going on here. Okay, there's now a disconnection between, quote, cases, hospitalizations, and deaths. Hospitalizations and deaths are trending down.
That's what I said, yes.
All over the place. That is the best news possible.
That's the number.
Absolutely. And the whole thing with the cases just seems to be people wanting to fan things and jack things up. As Bill has said, you go around and you look in a certain area where you know there's going to be a lot of cases, and you count all those cases, and then, oh, there are all these cases. Well, a case is not illness. We keep saying that. A case is just a positive test. Worse than that, for every one case the quote case, one positive test, we know there's at least one other person that doesn't have a positive test. This has no symptoms whatsoever. So positive testing.
Well, these college kids had no symptoms too.
Right.
I mean, they're well. They just got driven into a testing place.
And they're sharing the virus, and they'll get over the virus, and they're all fine. I think I've experienced this with my patients. Every patient I talk to every day, I say, when do you think we'll get back to normal? And they're all exhausted with this. They're like, I don't know. But
that is. They come in and sit down with you, and that is the conversation.
We start with the conversation there. How are you doing? Senior depression, all these other knock-on effects of people not getting their health care done, of putting something off. I mean, heart disease doesn't go away because the virus is here. Cancer doesn't go away because the virus is here. And all these things have been put off, and they're going to come in on us now. So I just really want us to keep emphasizing, probably start ignoring the case graphs and the case numbers and all that kind of stuff. That's just chatter out there. Watch your hospitalizations, watch your death rates. That's really kind of where you're going to know where things are now.
Right. All right. Now I want to get into that one just so we could put this thing about the long haulers to rest. We said here three weeks ago, I guess it was, we now know that there's not any reason to test patients after they've had their positive test people after they've had their 10 days. They might have this virus present for 60 or 90 days, and so it's at low number. Now what they've shown now is that in people who get in the hospital and get sick, when you get out of the hospital, whenever you get out, you might get out in 3 weeks, you might get out in 4. If you go back 6 weeks after hospital discharge, 86% of the people who really got sick in the hospital will still have an abnormality on their CAT scan in their lung. That's a big number. And then if you go out 24 weeks, that number falls dramatically. So show that first slide there. This was in, I don't know whether it was on, MSNBC or something, but they were talking about, if you'll notice what this says recovery from COVID-19 can take a long time, even in young adults with no chronic conditions. So what they were doing there is kind of pushing this down to young people. What they were talking about in that situation primarily, though, was when you've got mono, as we said a few weeks ago, you're not bouncing back quickly. You've got fatigue that lasts a few weeks. And if you look at that next graph there, at the very top, fatigue is the number one symptom that lasts beyond the time you leave the hospital. Well, after the time you get over being sick. I've got a patient at home right now, an 83-year-old woman with ovarian cancer on treatment, who feels great. She plays pickleball 3 days a week, and she bowls, and she wants to get out of her house, and the only symptom she's had is her sense of smell. She's not fatigued. She wants to go bowling. So after this 10-day period is over with, she still doesn't smell too good, and so she's got prolonged symptoms. She's back now in the bowling and the pickleball playing. So the fact that you still don't smell real good after 3 weeks or 4 weeks doesn't mean that you got some bad thing going on. This long hauler business goes to those patients that are in the hospital, probably had oxygen use sometime during the hospitalization, and if that was bacterial pneumonia, if that was the old flu pneumonia that got you in the hospital, it would be exactly the same. It's not different. So when you leave the hospital after a case of viral pneumonia 2 years ago, you get discharged and you go home, you're not back to being able to chop firewood and run a 100-yard dash just because you're out of the hospital. So this emphasis on the long period of recovery that lasts longer than 10 days and may go out to 6 weeks or 10 weeks is only for that group of people who really got sick. And I don't want people thinking that, oh my gosh, all these college kids with a positive test are going to have some problem. That's not what's going on. And I think that the hysterical talking head on the television set is making people frightened when the facts are that these college kids that got the positive test and the folks up at the Big Ten who say, yeah, we can go back and play ball, that's the attitude we need to have, is let the kids go to school and let the Big Ten go back to playing ball. I mean, I don't want the Big Ten to play ball.
Let me echo that, because sometimes hearing it twice really is important, and I want to make sure that people are hearing that we are being balanced about this. We're saying that 9 out of 10 people need to go back with their lives. Okay, they need to get back to their lives.
It's probably 98 out of 100.
Okay, but there's a small percentage that are the high-risk
people.
You
can take that down now.
And they still need to identify who they are. They need to protect their airspace. They need to, to be careful with themselves. Okay, because the virus is still out there. So we don't. And I don't want them to get depressed and further shut down. They need to constantly find other ways they can get back to their life, as Bill was saying, do your physical activities, do what you need to do. But be attentive to, that you need to be especially careful. What's bringing this to mind is there have been a couple outbreaks in the nursing homes around here. And, the nursing homes are given the rules from the CDC, and they're given the rules from the health department, and when you read the things in the paper, they say, we're following the rules, we're doing the best that we can do. Well, nursing home patients are totally dependent upon the people who are controlling that nursing home on whether they're going to get it or not. So those people need to be held to a very high standard. But the adults and the seniors that are out in the world, it's on them. It's on them. Are they protecting themselves the best way they can?
But they don't have staff to protect them. They got to protect themselves.
And so they need to be very aware of, how do I protect myself and get on with my life? Because we want them to get on with their life. We want them to get on with their good health care and stay after things. In the meantime, the folks that come out and say, well, we did everything we were told to do, that's not good enough with me. Have you thought about it? Is there something that's not going on right with how you're letting people in and out of that nursing home? I want them to be thinking for others and being that super responsible.
All right, so when you say we've had a couple nursing home outbreaks, you just touched on it, because I want to take that to, I want to put depression in there. And there's a difference in nursing homes and senior living facilities. Okay?
Right.
There is a difference.
Yes.
Okay. But we're dealing with executive orders from governors all across the country, and senior living facilities. I understand we can't have a revolving door of visitors. I get that. I understand there has to be caution, but inside that senior living facility is considered a community, okay?
Yeah.
They cannot have community meals still under executive order.
Right.
They have to have their meals in their
Isn't that
room.
crazy? And look at this, I just showed you that. They need to get back to that senior living exercise group that they go to, where they go down there and they do Tai Chi or whatever it is. Right? I mean, the fifth thing in the news this week, they need to be able to get their, if they got a daggum bridge group, let them go play bridge.
There's so many different senior living facilities. Some of these facilities have, just like you say, activity rooms where they can line dance. I don't know, but they have activity. No, so you know,
right,
that,
I know,
right?
yeah.
They have activity rooms. They have open areas where they have meals. They have clubs, bridge clubs.
Play
5 or
cards.
6 going to play bridge. Inside that community, can they not get back to
Yes,
that?
they can. And so
And they should.
You know, and I'm
Well,
very,
who's gonna
I'm
put
very
pressure?
proud of. Well, I'm very proud of what we've done here, because while there have been a couple of outbreaks in the nursing homes, there's not been one in our assisted living facility. Not one.
Now that's
Yeah.
different. Now, nursing home, as you said, is different from
Right.
from assisted living and senior living.
Senior living.
Senior living.
And the way I picture that, and if you go in there now, you'll see it's this way. When I go in, I'm tested before I go in, so I don't have the virus. When I go in, I wear a mask. The staff wear a mask. The senior living's the people in there that's their home. Okay?
Right.
They don't wear a mask. They're in and out of their rooms. They're milling around. Now, they can't do these things that the state's telling them they can't do, but they should be able to get to it because that's their home. They live together. That's their air. Okay? So the way we have envisioned this assisted living up here is you protect that airspace. And you don't, there's a barrier there. There's a mental barrier. You don't come inside here unless we know you're not bringing the virus. And we constantly test for that.
So the guy
There's-
delivering Coca-Cola off a Coca-Cola truck
He
does
drops
not
it
go
off.
in there.
He does not go in there. There's
He
no
leaves it
unreasonable
outside.
people to go in there. And the people who are coming and going, if there's any chance at all that they've been out to a funeral or out someplace at risk, they get retested. So, but if you have that discipline about it, they can get reasonably back to normal. Now, we've opened it up a little bit more that if a family member wants to come visit and they really want to see somebody, they can go outside in chairs and sit down with their family member, spaced, fresh air, sunlight,
Right.
for an hour or so, and have communion time with their family.
Now that's
outside
new.
the assisted living.
That's new.
That's new. So, and that's very healthy. But taking that very disciplined approach that I'm not just following the rules and I'm not just checking things off, I want these people protected. Okay? And that means I got to protect their air. And I want my seniors that are out living in their own homes, I want them to constantly visualize, is my home protected? Am I letting people come and go? It's that amount of time in dead air sharing those molecules and those droplets. That's where you get the inoculum, that's where you get sick. I have yet to see a case in my practice or in town where somebody got sick from walking in a big box store. Now, I know we have all this rancor about wearing the mask there and all that kind of stuff, and I put a mask on when
I
I go
think
in
they
there.
still should wear the mask in the big box store.
But I
anyway.
haven't seen a case
I
yet.
haven't, me either. No.
I think, and we'll move on from that, but I will tell you this, because we are in North Georgia retirement area, and we have a lot of seniors, but you know, we'll stay with Georgia itself. There's different parts to health. Health is not one thing. There's healthy, right? There's different parts to be, and when you're a senior, that interaction for stimulating thought and and talking and stuff like that that's part
That's
of
part of your mental health. I
That's
mean,
part of your- right.
we are a communal people. We're as an animal, we need each other. We're around each other. We humor each other. We encourage each other.
We fight with each other. Let me go back. I want to go back. I've got to fix. I've got to fix. I don't want anybody to misinterpret what was said there about we don't know about any cases that have occurred from a big box store. We really wouldn't, by the way. Okay, because there are cases that we do not know where they got it.
Right.
Okay, so still, yes, okay, so that's still where the hand washing comes in, and that's still where the so if you got a case that's sick and you've got no contact where you know that they got the disease, then you've got to still think. I mean, it's a hand washing issue here, or there was an exposure someplace, and it can be in a big box store. That's why I say I still think that you need to do those things when you're with people you don't know. As he said, inside this senior living facility, that's their family. I mean, we were playing spades with my grandson here this past weekend up here with my 92-year-old mother-in-law. So that's our family. We know that family, and I think that the old people in the assisted living places love to play bridge and pinochle and stuff, and they ought to be allowed to do it. Period, paragraph, that's the end of that. I want to go back, because there's some things we want to talk about here, because we've got the reason with the schools and the canceling of the games in the high schools up here. 4 college football games that are going to be played tomorrow aren't going to be played because there are so many kids in quarantine they can't field a team. I've forgotten who that is. It's not Notre Dame or anybody, but I'm not even positive that we got our arms around how that ought to be being done, because it's my understanding that one of the local high schools canceled their game because there was a kid that was living in the house with people that had the disease, were positive, that we don't even know if that kid was positive or not. And we know that the Big Ten jumped too early, and that now the Big Ten's backing up and beginning to realize that utilizing some sort of a protocol or bubble approach or frequent testing or something, they can play. Now, maybe because they need more money at Ohio State, as you were saying a little earlier.
Well, I know UGA fans out there are wondering what's the big deal if Ohio State plays or not. And I'm sorry to our Ohio State friends. I know we have them out there. But
anyway,
the Big Ten, and this gets me when we talk about spin. Players are going to be tested daily.
Well, and they have that ability now with that real quick test. That's 40 minutes.
And I forget what the exact title, but I think every school has to have an infectious disease coordinator on staff.
They have their Steve Marlowe,
right?
Steve Marlowe.
Everyone.
I think it's important to remember that it really ought to be somebody that knows and understands that process, and not a psychiatrist or a obstetrician who's working by the hour or something and just has an MD after their name.
Well, worse than that, L.A., where they've got that lady who's not, she's a PhD. She refers herself to doctor, but she's a PhD doctor. But, she's not going to let the L.A. school systems open up until after the election. I mean, that's such BS. It's unbelievable. But, you need somebody who's knowledgeable and also not political. That looks for the best, for what's best for these kids.
Talked to a coach this past week, another part of the state, just to find out, hey, how are you treating this? So, coach, kid is positive. What do? We send him home, play football.
That's what I told you a month ago.
Now this is
it's South Georgia where they got big ball on.
This is 200 miles away from here. I wanted to go off and to where nobody could connect the dots, and I don't mean that like I'm checking in, but I wanted to see. So we send them home, play football. This is starting to be a problem, and let me ask you this, okay? The two of you deal with medical privacy on a daily basis, okay? You understand it all too well, your privacy with your patients, okay? So parents are basically, kid is sent home and being told they are quarantined, they're in quarantine. Parent says to the school system, why is my son or daughter quarantined? They're quarantined. Who were they around? Okay, what happened? Was it in math class? This individual's medical privacy prevents us from telling you any more than we sent your kid home for 14 days.
Yep.
I mean, where's the balance here?
I hate to tell you, but you're not going to get away from that. You can thank Bill Clinton for that. Bill Clinton wrote up the HIPAA rule that solved a problem that didn't really exist, and if somebody blows that thing, it's a $10,000 fine, and they can stop you from being able to collect Medicare, Medicaid, and insurance payments, and you're not going to find a medical professional that's going to violate that thing, because he can get spanked publicly.
Badly, yeah.
It ain't going to happen. We don't agree with that, but you aren't going to find anybody that's going to violate that, because the fine is $10,000, and they can stop paying you. Medicare, Medicaid, and insurance companies can stop paying you.
But your point is well made, is that you've got somebody saying my child is quarantined as though my child now has leprosy or something. You know, there's this sort of little connotation about it. Just
or that
because he
he's
was in the
dangerous.
same room.
Yeah, he's dangerous to somebody else because somebody else did something to him. We don't know who it was.
Who is making the decision and going in that? For example, I mean, locally, football team quarantined.
Yeah.
And no parents. I'm going to say I've spoke to 10 parents. Nobody got a clear answer.
Yeah.
Nobody got a clear answer. And the thought is it's not just football. I don't want everybody to think it's just sports and we're going to bypass health just because we want to watch football. They were not in school also.
I know, and it's out of control. It's like the day the courthouse got shut down and they spent $70,000 cleaning it up. Well, I mean, who made that decision? How did that happen? How do we go that far overboard? We're talking about an illness in children that's less dangerous than influenza. We have influenza every year. Now, in children, it's less dangerous than influenza. They're not sending schools home and locking rooms down for the flu. I mean, they may close the school for a day or two if there's a massive outbreak.
But not for one kid.
But this same school system, my understanding is, I want to keep a little opening here, but I'm pretty good with it. My understanding is the entire band is now sent home.
Yeah.
And the entire softball team is sent home.
It's not logical.
Not
logical.
But the point is, I think your point is, who made that decision and what kind of a medical authority
exactly
was supposed to have the expertise to be able to make that decision, and was it overblown?
Yeah. I think it is. I mean, I don't know where they're getting their information from, but it's not logical. It doesn't fit with what we know about this virus. And now we know a lot about this virus now.
We know a lot of that is a big sentence, small but big. We know a lot about this virus now because, as you well know, the three of us started from day one when this really took off. We started from day one on the air, and I have personal, connection to this. We know a lot more about this today.
Do you really remember that we were going through the medical news? It was January when I said there's a viral epidemic that's just started in a small place in China. Who would have ever thought that day we'd be where we are today? I think we need to go. We need to go a little bit farther here, because we said when we were doing our prep, that we were going to get to talking about this vaccine business.
That's where I wanted to go.
You had some real points you wanted to make, so I'm going to shut up.
I want to say, because I'm just out here and I went and I was reading success rate. Now, we're not calling this the flu. I want to be clear.
Right.
But success rate for a flu vaccine, 60% effective?
Yeah.
Right?
The best years is 65%.
65 is. So, and every year the vaccine changes because the flu strain changes.
Right.
So, 2 weeks ago, I watched the CEO of Pfizer, okay? He said they're in production now with the vaccine, okay? He said that they will have their testing, they will have their results ready into October, and then it's going to be clearly up to the FDA. Now, let's say that gets released, and in November it gets released and they start putting it in.
They say mid to late November.
And they come back and they say it's 52% effective. I'm concerned that the media is going to say it's a failure because it only works 52%.
They will.
Right?
You know the media will do that.
But
they're already beating up on the vaccine.
Right.
And they need to not be doing that. People are inherently, instinctively scared of new things. Okay? Which they should be. As a race, we need to be, testy and say, is that good or not good?
Let me.
The vaccine is a humongous event, and will protect a lot of people net, and folks need to be encouraged about it.
But let me say one thing about this. Yesterday, Moderna, or whatever that is, they are doing the vaccine same as Pfizer, which is the messenger RNA from the virus, and they put out a 186-page summary of their experimental protocol. And the reason they did that was that the industry said we should be transparent into what the real timing is, because there's so much political comment that we need to be ready by November. So here is what Moderna said. They will first analyze their data in December. Well, that ain't November. That means just analyzing the data. That it would be March before they would have the full efficacy data and safety data and could meaningfully say that the vaccine could be given to the public. So that's the company that's working with Oxford or whatever, and they are making the exact same virus as Pfizer, same technology, messenger RNA. Now AstraZeneca, who's got a different technology, you remember they put their thing on hold because of the neurological case they had, and now they're beginning to bring in people. So I believe that business about something being ready for us in November is not going to happen, and I've said that every time it's come up. Yes, Pfizer might be able to get to the point by late November where they can say we've got antibodies in greater than 50% of people, that in a relatively small group, but you won't know that it's 50% effective until you've been able to have it out there for a while, and that was the bar that the federal government put on it.
I guess here's what I want to say. I don't feel that there's going to be a company that's going to fudge the results to get it to market.
They won't do it.
No.
So when Pfizer,
the financial risk of that's catastrophic.
Right.
Well, it's scientific
exactly.
risk. They won't do it. I
so
don't
when
believe.
Pfizer says they're going to have it ready by the end of October, and it will be up to the FDA they can't answer to issue the license. Far be it from me, because here's the one thing in the media that it's very frustrating, is the headlines. Many medical experts concerned that they will rush the virus. Experts concerned because they will rush the vaccine.
Yeah, I hear what you're saying, but Brian, there was a poll they did because of this quote negative press, and who knows why we need to be having negative press about a vaccine. That's what I'm saying. That in one party there was a poll: are you likely to take the vaccine or not? And in the light of this new negative press, it's gone from 72% saying, yeah, I'm likely to take it down into the 40s. Just from people
Those were
throwing cold
Democrats.
water. Yeah. Well, I'm trying to not be political here, but that's how much the press can sway things. Bill is right. We're not on the inside. We don't know when this vaccine is going to get out there for real. We don't, we're not in those labs. But what's really encouraging to me is Pfizer is manufacturing this vaccine. They're building a whole new plant in Germany to manufacture this. Right. That's a significant outlay of capital that says that they're pretty confident.
Yeah, but they've already got $1.5 billion from our government.
I watched the interview with the guy. I read two articles.
So, I mean, that's encouraging. We can't hang our hat on the vaccine, but people need to know, hey, the vaccine probably going to be a really good thing, and the sooner the better. So,
and again, to reiterate, when we hear these headlines, okay, they're false. These companies are not going to rush to try. There's called November 3rd, and I'm going to feel good.
Well, what's November 3rd?
Well, election day. But I'm going to feel good that pharmaceutical companies just have that as another day on their calendar.
Here's the way I see it rushed.
Absolutely.
Here's the way I see it. It's not rushed. What's happening is it's not I got this memo from Pfizer and I put it in my inbox and I'll get to it next month. Okay? That's what's not happening.
Right, they're working 24 hours a day.
Well, we're standing here for Pfizer to hand us their numbers. Tomorrow we're going to open them up and we're all going to start going through this, and then, you know what I mean? It's all compressed. You don't have these big pauses and gaps. Well, so-and-so's on vacation. We can't talk about
That's the way it would have been if it was just coming up with a new antibiotic or something.
Yeah.
What the two of you are going right down the road I want to go. They don't, what I think is they don't understand when bureaucracy's not in the way.
Right.
And when they hear that the president has done what's called fast track.
Right.
Fast track.
He just took all the barriers out of it, and he told guys, I don't want you taking any time off. I don't want you going on vacation.
Right. This is what the fear is when they're calling rush. Now, I said this earlier on my program this week, and I know it's not correct to make the comparison, but remember when the bridge collapsed on 85?
Yes.
Collapsed, right?
Right.
So we came out and we said, hey, this is a big problem.
It's going to take 6 months.
Right. And we said, look, the company that can put it back in 30 days, not 6 months,
gets a big
we're going to
bonus.
get a bonus. I don't care, you got to work 7 days a week because it's
And they
detrimental to the
24 hours a day. They worked 7 days a week, and it was back up in, 38 days or
That's
something.
basically what the president's done with this virus when they call fast
And that's,
track.
I mean, I'm sorry, that's good leadership. I
But
mean,
you
it's
understand
like,
what I'm
look,
saying?
this
Is
is a
that
relay.
is that what people out there need to understand?
They need to understand. This is a relay. You're passing the baton. The guy who drops that baton is going to have his head taken off.
Okay, I want to stop it. I want to stop it.
But we're not rushing it at the risk of people.
All right. This is September the 18th.
Yes.
Right now, in 1944, General Patton was outrunning his supply line. He was going 140 miles a day with those tanks. Nobody had ever done that before. And how did he do that? His boys were working 24 hours a day, 7 days a week, and behind them they had tens of thousands of people putting gallons of gas in cans in the backs of trucks. It takes a huge infrastructure to have a small combat team up here. Now you're making this virus. You've got probably in each company, you probably got 30 or 40 PhD, MDs, these guys with all these degrees, but beneath them you've got tens of thousands of people with big vats of stuff trying to make these things happen. So you've actually mobilized an entire industry like you mobilized an army.
Right.
And in a war situation, you're on in the Navy, you're on 8 and you're off 8, or you're on 4 and you're off 4. And in the Army, it's usually on 12 or off 12. You're on 24. Well, these people in this industry now are working 12-hour shifts.
Right.
And they're working 7 days a week, and they're getting paid for it. But they got the best people. You got to have somebody down there to open the doors. You got somebody to clean the floors. Can you imagine how many people in the biggest pharmaceutical companies in the world that are in this industry are doing? How many people are out there doing it? It's not just a few scientists. It's all these privates and all of these corporals doing the work, and that's a huge thing, and that's leadership. That's Trump acting like Patton.
Well, and between start and delivery to the people, they've cut out the cocktail parties. Bottom line.
Yeah.
I want to get into the distribution of it because I watch all the press conferences. I mean, even if I don't get them, I'll watch them at 10 o'clock at night. I make sure I keep up with what we're being told. So I get the media and their scare tactic, and then the president will hold a press conference. And not to go down political, but the other day in a press conference laid out very methodically that the distribution chain is ready in this country. What does that mean? You got a vaccine ready, FDA. What does he mean when he says we've been setting up the distribution chain and it's ready to go?
All right, let's say it's got to be maintained at under 40 degrees. It's got to be refrigerated.
Right.
It's got to be transported. It's got to be transported from Germany, where it's going to be manufactured, just like Amazon.com. If you turn this all over to Amazon, you'd get it delivered in 24 hours to most big cities, and you get it delivered elsewhere in 2 days. If you turned it over to the post office department, it takes 6 months. So what he's saying is he's got private industry that's going to put this stuff in refrigerated boxes and deliver it to Riverstone within 7 days of the time it's made in Germany. That's what he means by the distribution system.
And that's the logistics of it. And Bill hit the nail on the head. I mean, a lot of people don't understand that half of what the Army's success is based on is the logistics of getting supplies, ammo, and fuel and clothing to the soldiers. That's all behind the scenes. There's no glory in that, but that's got to happen in order for those guys to march ahead. And you know, we don't see this, but you know,
well, till the vaccine gets in his office.
Yeah.
Right.
There's no vaccine, right? It doesn't exist until it's in his office and be given to somebody.
Okay,
well, it's being made in Germany. How long do you think it would have taken to get from Germany to here on a boat if it had been a Mercedes before this thing all started? It would have been delivered in 90 to 120 days. So what they're doing now is they're creating a system. It's all going to be done on airplanes. It's going to be done by FedEx and stuff like that. And the private industry is going to be delivering it. It is not going to be the government. You turn it over to private industry and let Amazon do it.
Yeah, it's impressive. It's to me, it's so encouraging. I mean, it's one of the breaths of fresh air. You know, the whole area of this research now is being revitalized. There's a drug that's being rolled out right now. I can't remember which company it is. From start to finish was 7 months. Okay, that usually would have been 7 years. 7 years, 12 times longer. That they've accelerated the testing and production of this drug that's just coming out.
Now, cancer drugs are like that now.
Yeah, I mean, that's innovative.
Innovative. So let's just wrap up this, and then both of you close up this morning. But for our viewers out there, we're well on our way to a vaccine that could be very successful to combat this COVID. We're well on our way with that, and a distribution effort to get it where it needs to be is definitely in place, getting in place, right? Would we agree on that?
Absolutely. And my only caveat is there's a lot of science that has to fall together right to get the efficacy at 50% or greater, which is what everybody wants. I would say if it's 25% or greater, get it out there. That's going to get a bunch of people immune. It's just going to be that you got to get more people immune. That's the only way you're going to do it.
Any kind of thought you had this morning coming into this you want to make sure we convey to the people out there?
Yeah, I mean, I just want to re-summarize that. I didn't mean to imply that you shouldn't wear your mask in big boxes. I just want people to really. What makes our country great is the individual initiative and individual responsibility. It's not this somebody else is going to take care of me business. It's so much coming into our society. It's that the great generation folks that said, you know, what do we have to do and how do we get it done? And the seniors, they're just under that generation, and they know what that is. They know, what do I have to do to get this done, do it right, and take that responsibility and make it happen.
Thank you, Dr. Tidman. Dr. Whaley.
Donate blood.
That's it?
I don't say it every week.
Donate blood.
Donate blood.
At least you didn't tell me to get a haircut.
I got my haircut. Yeah, and the other thing, I mean, seriously, I want you to go live your life. I want the kids to go to school. I want the boys to play football, and I don't want them to cancel a game because one kid's sick. Now, if you got 28 guys like Appalachian State or whoever it is can't come out and play, then you haven't got enough players. But if one kid's sick or two kids sick, it's just like two kids got knee injuries. Don't let them go sit on the bench and replace them with somebody. Live your life.
Live your life, give blood, and I'm going to add, make your doctor's appointment, okay?
There you go.
Because there are much, yes, there are many other health issues that we deal with that we cannot let go and not see our family doctor and make an appointment. So make an appointment, give blood, live your life. Thank you guys so much.
Northside.
I appreciate it. Northside. Yes. We want to thank North Georgia Cancer Research Center, affiliated with Northside Hospital. You see it there on the screen as we're doing the segment. Riverstone. Anything else?
Yeah.
And don't forget, folks, you can always send this segment to your family and friends that you want them to see it. You can find it on FYNTV.com. Ask the Doc, and also on our YouTube channel, FYNTV Fetch Your News YouTube channel. The playlist is Ask the Doc. Right after these messages, the All-Star Political Panel. Thank you, guys.